Uh, Good evening. Today's class is a little bit complicated, and I must tell you in Bengali also, but mainly in English. Because all these things uh, explaining in Bengali is not so easy. But I will try my best to talk in English and also in Bengali. Again, today I am going to share a unique idea. Which one I have decided in the evening. I think I was in search of this type of idea, but previously it was not clear in my mind. But today I am confident enough that it is in my mind very good idea, which is can be expressed, can be explained only with the idea of homeopathic therapeutic system, the unique idea. Today's seminar is on, you have seen, gynecological problem and genetic homeopathic therapeutic system. So, according to the subject, I must have to tell you that all the problems we are suffering from the genetic makeup of the body. To make you easy understanding, I have find out a unique idea. That is, a tiny spark can cause huge fire, which can destroy a locality. Instantly or gradually, if it gets sufficient flow of wind or oxygen. This simple thing, this simple idea, you are all acquainted with this. It's a very common idea. If you throw little part of fire like end of cigarette or bidi, if you throw it on dry anything, it may be part of any tree or bush or maybe anything. And after that, if there is sudden blow of air, that spark will become huge fire. With this huge fire, a locality can be destroyed instantly or gradually. This part I want to tell you in Bengali. Because this idea is very effective in case of genetic homeopathic therapeutic system. যদি কেউ এক টুকরো বিড়ি বা সিগারেটের জ্বলন্ত অংশ কোনো ঝোপে, শুকনো ঝোপে, খড়ের গাদায় বা কোথাও ছুঁড়ে ফেলে, ওখানে ধীরে ধীরে হয়তোবা আগুনটা খেতে থাকবে। কিন্তু যদি হঠাৎ হাওয়া ওঠে, that little fire will convert into a huge fire. ভয়ানক অগ্নিকাণ্ডে পৌঁছে যাবে, পরিবর্তিত হয়ে যাবে, এবং সেই অগ্নিকাণ্ড একটা লোকালিটিকে মুহূর্তের মধ্যে ধ্বংস করে দেওয়ার জন্য যথেষ্ট। আমি এটা নিয়ে অনেক কথা বলবো, তার আগে বলে নিই যে পার্টটা আজকে আমার সাবজেক্ট, সেই পার্টে মডার্ন মেডিসিনের শুধুমাত্র সার্জারি, কেমোথেরাপি, রেডিওথেরাপি ছাড়া আর কোনো উপায় নেই। তবে একটা কথা তাদের থেকে আমরা জেনেছি যে BRCA1, BRCA2, that very gene located in the chromosome. I will show the numbers of chromosome where they are located. If the woman carry it, they will be the easy victim of cancer, breast, first breast tumor, tumor in the ovary, and that tumor will be spread, producing cancer. But the suggestion of the modern medicine, better you cut both the breast. If it is there means BRCA1, BRCA2. Likely they are also very interested for bilateral salpingo-oophorectomy. By this way, prophylactic. আমি নেক্সট ক্লাস আমার হবে, আমি প্রবীরকে বলবো, সে হলো prophylaxis and genetic homeopathic treatment, on which I have started thinking. The next class will be on prophylaxis and genetic homeopathic therapeutic system. So this time, I want to share this idea for modern medicine. Yes, they are very rich with their knowledge regarding investigation, like BRCA1, BRCA2, where they lie, in which chromosome, in which part of that chromosome. They are master of that. But they have no procedure of treatment, a specific procedure of treatment of that. They are interested to Tommy, means where they are very much susceptible, where they show the susceptibility of the part of the individual, they want to do the Tommy, means prophylactic surgery, but no specific treatment. Yes, they claim that they are the physician of modern medicine, but no more procedure of treatment are there. আমি বলতে চাইছি মডার্ন মেডিসিন তারা অনেক জ্ঞানী, জ্ঞানী ইন দ্য সেন্স দে আর অলওয়েজ, তারা এই ব্যাপারে, এই যে গবেষণার ব্যাপারে মানে এর পিছনে দায়ী কোন জিন, সেই জিনটা ক্রোমোজোমের কয় নম্বর ক্রোমোজোমে আছে, সেই ক্রোমোজোমের লোকেশন কি, এটা অনেক বড় কথা, তারা এটা বের করেছেন। রিয়েলি উই আর থ্যাঙ্কফুল টু দেম, বাট they have no specific treatment. They can take the preventive measure by cutting that affected part. If it is sin, it is going to that very susceptible to produce tumor. Before tumor, there is cancer. Before cancer, there is location of tumor. And after that, tumor changes into cancer. This is their idea. I will show you it where from I have collected what. Before that, I want to share the screen. See, just now I have told you that very unique idea, unique explanation for the treatment of different part of female genital system. What I have told you, a tiny spark can cause a huge fire which can destroy a locality instantly or gradually if it gets sufficient flow of wind or oxygen. Very common idea. So what is the use of that? See, what is the use of that? A tiny spark denotes active harmful group of genes. First, let me tell. A huge fire denotes overactive harmful group of genes. Can destroy a locality denotes can cause suffering or death of an individual. Better, we should use the word of a victim or of a victim. Now I am. God. Or of a victim. A locality denotes human body of a victim. Wind or oxygen denotes environment. Can destroy a locality instantly denotes can cause instant or sudden death of the victim. Can destroy a locality gradually denotes can cause sufferings for prolonged period of the victim. So, what I want to tell you with this unique idea, this is the first information according to the study of the real reproductive system is everybody inherit all 6 group of harmful genes. When they are inactive, nothing to say. But when they are active, that means that active group of harmful gene can be compared with a tiny spark. So it is with that very individual. It becomes huge fire. It transformed into a huge fire denotes overactive harmful group of genes. You know very well that when everybody is born with 6 group of inactive harmful gene, they become active, and with the advancement of age, they become overactive according to the information or blueprint of the genome. And that overactive state can cause destruction of the human body and can cause instant death or sudden death. Or that's very sudden death. What I want to say is that from heart failure, it can happen. from CVA, where a drop of blood in pons nucleus, never the individual come back. But if it is not in the pons nucleus, then they have to suffer for prolonged period with bedridden condition. So I think this idea, you are very much clear regarding this idea. That is why the study of genetic homeopathic therapeutic system, what we tell? We tell that if treatment is started from beginning, since first day of life, then what we can do? We can keep them inactive forever. But physicians of other therapeutic system, including classical homeopathy, modern medicine, Ayurvedic system of medicine, Unani system of medicine, they will tell from pathological investigation, if there is no clue, that means no indication of anything, they will tell, yes, no need of any treatment now. On the other hand, the physician of modern medicine, if they see from pathological report, yes, BRCA1, BRCA2, that situation is here. From genetic study, it is found out that this individual is having BRCA1, BRCA2. So that individual should be treated. But how? Only ectomy, bilateral mastectomy, salpingo-oophorectomy, like this. But you know very well, when a person is having or carry the cancer-bearing gene, so only with the Tommy, you cannot give her that healthy life. Yes, there may not be the attack of cancer, but as this type of gene is there, so the individual may be the victim of cancer any part. Little later I will show you that this type of victim, this type of woman, they can be attacked with colon cancer, they can be attacked with pancreatic cancer. Then what is the effect of prophylactic bilateral mastectomy, prophylactic salpingo-oophorectomy? Because you know very well, as you are with me for prolonged period, as the victims are carrying that very gene from beginning. So at the first part of life, they remain inactive state. But according to the blueprint of the genome, that inactive gene will become active and next will become overactive. So that very individual must have to suffer from cancer. May it not in the breast, may it not in the ovary, may it not in the uterus, but they are there. The criminal is there, so they will not leave that very victim undisturbed. So what I am telling, I have known from Reason, Davidson. I will show you. And that part I will give it to the group by which you can earn knowledge from that very writings. So Tommy means for a prophylactic Tommy cannot save the victim from any unexpected future, undesired future, the bad days of that very cancerous lesion. May not be breast cancer, may not be ovarian cancer, may not be a cancer in the fallopian tube, may not be a cancer in the uterus, but they can cause tumor in different part of the body. And that very tumor will transform into cancer. But one thing we are grateful to the modern medicine, they can take blood report if there is cancer marker CA1 to 5 and ASB4 like this are there. So they claim that yes, you are going to the victim of cancer in this part. So what to do? You have to you have to do the Tommy, that prophylactic Tommy of that very affected part. But this is not the solution. This may not be, this cannot be, that must not be the way of treatment. But modern medicine has no specific treatment for this. Then what to do? We have to do that active harmful group of gene, we should transform into inactive. And also for the overactive harmful group of gene, we have to do them inactive permanently. Then only that very victim will not suffer from this very painful disease. So, for the human civilization, the genetic homeopathy is having the idea. This idea should be spread throughout the world. Then we can save them, the victim, from this very painful disease, that means different cancer. In my book, volume 1, I have written very carefully how we can get the idea that very innocent individual now having no problem. But with the advancement of age, that very victim must have to suffer. And how I have gathered, I have acquired knowledge regarding this, I have written there. And those who read very carefully, they also know how to diagnose that you should be very careful, because in future that very bad days, that very cursing days of curseful are waiting for you, because you were the symptom of that immediately after birth, like in the first part of life, the different discharge was observed from external genital part of the female baby. This is the first sign. But the person is with you, is of 90 years of age, he will not tell you. It is impossible for her that is there any discharge from external genitalia immediately after birth or earlier days. It is impossible. But if you think over the situation in this way, that will you please tell me what type of problem you are having at the first part of life, before puberty or after puberty? You can get the idea. Yes, before puberty, so many problems, that is profuse white discharge. After puberty, the menstruation started uh, late or earlier, or it was very painful. It was menometeresia. It was menometeresia. I have written all these things in my first volume. How you can get the idea that today's individual of early age must have to suffer from that very painful condition, that very painful carcinoma in different part of the body. So you can profess from this and this and this point, 1, 2, 3, 4. I have written in my book. Yes, this is the indication. You are having pain in the genital part. You are having bleeding after coitus with husband. You are having profuse white discharge before puberty. You are having profuse menstruation uh, after puberty. You are having painful menstruation. You are having menometeresia. You are having very unhealthy physical condition after puberty. You are not interested for getting married. So everything is abnormal. These are all indications. These are all the indications for different, complicated, painful condition. So if you read my book, you can profess regarding this point, yes, the days are waiting for you. And you should not any prophylactic measure. You should not take any prophylactic measure. I will prevent it. You have to tell. Because you are having medicine to make all the overactive harmful group of gene, active harmful group of gene, to make them inactive permanently. And from the careful observation, you will understand yourself and you will assure the patient that the coming days are good days, they are waiting for you, as I have make all the harmful active overactive genes inactive permanently. What is the proof? You see, you are all these problems, this and this and this, when you came to me first, and now it is decreasing. Only healthy signs are there, and you can observe it very carefully. Then the patient will tell, yes, I am enjoying my days. Previously, it was very painful condition. There was no hope in my mind. Now I am confident enough. Nothing will happen to me. But I know, I have told you, at the first day, my grandmother was having uterine carcinoma. My mother had breast carcinoma. And I was waiting for any part of that because previously I had menstruation is with unbearable pain, uncontrolled pain. Every month I had to take the different painful painkillers with antacid. So I was not happy with my previous days. But now I can understand nothing will happen in future. And it is possible only with your treatment. So this is the latest idea according to study of genetic homeopathic therapeutic system. Let's go. So mind it, if you do not extinguish that tiny spark, nothing is possible. And in genetic homeopathic therapeutic system, there is 8 medicine, 6 cycle, and philosophy of earliest part of life. To extinguish the tiniest spark permanently. So you are having sufficient weapons to proceed with confidence. Nobody will have to suffer from malignancy, the painful suffering. See, one thing I want to share with you that during hypertension, during the class, in the class hypertension, there I have showed that different group of gene, they make the individual victim of hypertension. And these are the group of gene, they protect from that. No, I have told this when I was when in the seminar of I think diabetes. I think I have forgotten. But I have told you because the nature has given both the thing. One for making the victim of an individual. Responsible group of genes are there. On the other hand, the nature has given us that a certain group of genes, they are the responsible factor to protect, to save the human being. Then you will ask, sir, why then the individual become the victim of different painful disease? Yes, very right question. Because different procedure of treatment for different problem, they cause separation. That from that very separation, there is trauma. So that very trauma pour oil or ghee on the fire. And immediately there is huge fire to destroy the locality means human body. Then what should be done? No suppression should not be done. Like this way, a person has come to you for fever, sore throat, associated with this anorexia, sleeplessness, and physician will find out medicine for those suffering. In all pathies other than genetic homeopathy. And with their effort, that very individual must become free from suffering immediately, shortly. They have not prescribed any medicine for the origin of this very suffering. They have selected, they have prescribed medicine for the present complaint only, from which respected Sarjeti can beautifully explained. If you do that, what will happen? It will create suppression. From suppression, trauma will be created. And that trauma pour oil to the fire. And that, from that very huge fire, the body of the victim will destroy immediately or gradually. When immediately? When there is lesion in the heart for creating heart failure or CVA, cerebrovascular accident, from which a single drop of blood is poured in the pons nucleus. So immediate death, immediate destruction of the locality, immediate destruction of the human body. If it is not there, there must be prolonged suffering for prolonged period, as because there were fire was created by the medicine, which was originated from that very suppression, from that very trauma. So the helpless individual become the victim, must become the victim of so many severe, painful sufferings. So behind any problem, any painful condition, may it not be cancer, they may appear. Let's share that very part. That thing what I have just explained just now. See, BRCA1, chromosome number 17, Q, and 12 to 21, there is very portion, they are there, BRCA1 gene. And BRCA2, chromosome number 13, Q, and they are there in different position, 12 to 13. I have told you this one, but see, if there may not be cancer in the ovary, in the breast, in the uterus, in the fallopian tube, but I have just told you that they may be victim of pancreatic carcinoma, colon carcinoma. Besides, you see, the complex genetic disorder. It is from Harrison's Principle of Internal Medicine, 19th edition, page number 440. See, the expression of many common diseases. See, very carefully, please see. And that part I must share it in the group. The expression of many common diseases, such as cardiovascular disease, you know very well, hypertension, that means high blood pressure, diabetes, hyperglycemia, asthma, that very breathing problem, psychiatric disorder, the mental problem, certain cancer is determined by a combination of genetic background, environmental factors, and lifestyle. See, may it not be cancer, but so many problems we are having. We are carrying the responsibility. If a genetic homeopath cannot inactivate them, so that bad days are waiting for us, for everybody. So many things you have seen. You are saying. But that very on this ground, that environment and lifestyle, environmental factor, lifestyle. What is this? See? Environment, what is environment? And what is lifestyle? This is the symbol of wind or oxygen. If there is blow of wind, then a spark, a tiny spark become. I think I have not told you right thing. If there is tiny spark, if there is blowing of wind or oxygen, this wind or oxygen denotes environment. They are telling here, for this, environmental factor and lifestyle are responsible. But you see, if there is, oh my God, if there is no tiny spark, please think about this. If there is no tiny spark and flow of sufficient wind or oxygen, is it possible to establish huge fire? If there is tiny spark, then it will become huge fire. If there is not there, that there is no tiny spark, or you can think about this, the tiny spark can be extinguished if there is sufficient wind or oxygen. Is it possible to become that very, what I can say, that very huge fire for destruction of the locality, that means the human body? You see, you have to think about that. I have thought a lot on this small saying, and you please consider that one. A tiny spark can cause a huge fire, which can destroy a locality instantly or gradually if it gets sufficient flow of wind or oxygen. Yes, the environment can play an important role. But if there is no tiny spark, if the tiny spark, the physician can extinguish that very tiny spark, that means the physician can inactivate the active harmful group of gene, then what will environment will do? But in modern medicine, they give very importance to the environment, to the lifestyle. What do you see? Is there any scientific view behind this idea? Please consider this very point very carefully. Environment can do nothing. A lifestyle can do nothing if that very tiny spark is extinguished by a genetic homeopath. Yes, that environment, that lifestyle can cause, but they cannot create that very painful situation, that very fatal disease, which can destroy the human body. Only changing environment, only changing lifestyle, all the problem will be solved. But if there is tiniest spark, that is active harmful group of gene or overactive harmful group of gene, and if it is impossible for you to extinguish this very spark, nothing can be done. That victim must have to suffer from that very painful, incurable disease. This very idea. You please try to understand why you're hurt. If there is any question, you can ask in the class or today. I am ready to give you answer. Because if you do not have clear idea regarding these small sayings written by me, it is impossible for you to do anything good for the victim. No, this is the idea. Let's go. Next part. And you have seen so many problems. Everybody carrying the responsible group of gene. That very gene, that very spark, if it is extinguished by a genetic homeopath, nothing will happen in future. I have seen many more times in the patient. Previously, that very small individual had to suffer a lot during change of season. আমি তো বাংলায় কিছুই বলছি না অ্যাকচুয়ালি, বাংলায় বলবো এবার। If whatever, only idea is this, which is the main weapon of a genetic homeopathic physician. That is, if the physician is very careful for study or treating the individual, considering this very point, the point is a genetic homeopath must have clear idea how to extinguish a tiny spark. A tiny spark means active harmful group of gene. If the physician is having like this idea, nothing will happen to that very victim. Although different individual is born with many more tiny spark, and they are waiting to become huge fire, and you have to do that. And yesterday I have shared that idea, the important prognosis of unsatisfactory evacuation, and that very chapter will give in the which one? That tomorrow morning Mona will give it, and you please download that very chapter and try to read it by heart many more times. Not memorize. Try to understand. Up to this part, I want to tell in Bengali. Because বিনা মাতৃভাষা মেয়েটা কি মনের আশা? তাহলে সোজা কথা হলো, আমরা বিভিন্ন ক্ষুদ্র ক্ষুদ্র অগ্নিস্ফুলঙ্গ নিয়ে মায়ের পেট থেকে যাত্রা শুরু করি। তারাই ভাগ্যবান যারা মায়ের পেটে থাকাকালীন মায়ের মাধ্যমে জেনেটিক হোমিওপ্যাথিক মেডিসিন পেয়েছে। যারা পেয়েছে সব ক্ষুদ্র ক্ষুদ্র অগ্নিস্ফুলিঙ্গগুলি নিভে গেছে। তারা কোনো দিন আর দাউ দাউ করে আগুন হয়ে জ্বলবে না। যেহেতু জ্বলবে না আর, কারণ তারা ইনঅ্যাক্টিভেটেড হয়ে গেছে পার্মানেন্টলি। প্রথমে ইনঅ্যাক্টিভ ছিল, কিন্তু সেটা অগ্নিস্ফুলিঙ্গ, বোঝা যায়। একটু একটু হাওয়া পেল, ও টিক টিক করে জ্বলে উঠল। যখন জোর হাওয়া পেল, দাউ দাউ করে জ্বলে উঠল আর মেরে দিল আমাদের প্রত্যেককে। কিন্তু মডার্ন মেডিসিন এটা জানে কোথায় কি হয়েছে, কি হতে চলেছে, কিন্তু তাদের কাছে সেই জ্ঞান নেই কি করে ওটাকে কোন রকম সার্জারি ছাড়াই চিকিৎসা হতে পারে। আর সার্জারি কি সার্জারি? প্রোফাইল্যাক্টিক সার্জারি, কোনো ডাইরেক্ট ট্রিটমেন্ট নয়। কারণ আমরা সবাই জানি যে জিনটা আগামী দিন এরকম বিভিন্ন অসুখ হতে চলেছে, অসুখের মধ্যে ফেলে দিতে চলেছে, সেই জিনগুলিকে যদি ইনঅ্যাক্টিভ না করা যায়, মানে ছোট ছোট আগুনের স্ফুলিঙ্গকে যদি নিভিয়ে দেওয়া না যায়, ওরা হয় আজ, না হয় কাল, না হয় পরশু, না হয় 5 বছর পর, 10 বছর পর ওরা দাউ দাউ করে জ্বলে উঠবেই, আর মানুষগুলোকে ভুগতে হবে। তখন ওনারা বলবেন আমরা অনেক করেছি, এখন বাড়িতে নিয়ে যায় ভালো মন্দ খাইয়ে দেন। মাই গুডনেস, ইনস্পাইট অফ দ্যাট, এ সত্ত্বেও তারা নিজেকে ক্লেম করেন তারা হলেন মডার্ন মেডিসিনের সায়েন্টিস্ট। সে একটা বাংলায় কথা আছে, নামে তাল পুকুর ঘটি ডোবে না। অনেক জ্ঞান আছে, কিন্তু রোখা যায় না। কিছু কথা বাংলায় বলা যায়, ইংরেজিতে বলা একটু কঠিন হয়। আর বেশিরভাগ কথা ইংরেজিতে বলা যায়, বাংলায় বলা একটু কঠিন হয়। কিন্তু এটা কিন্তু বাস্তব। যদি মডার্ন মেডিসিনের বই পড়বে বুঝতে পারবে আমি যা বললাম সেটা ঠিক কিনা। এই তো, এই যে ফ্যামিলিয়ার ব্রেস্ট ক্যান্সার, দিদিমার ছিল, মায়ের ছিল, এখন মেয়ে, তারও ব্রেস্টের মধ্যে গুটি দেখা দিয়েছে। ডাক্তাররা বলেছে ব্রেস্ট ম্যাস্টেকটমি, বাইলেটারাল ম্যাস্টেকটমি করে দাও, ভালো থাকবা। মিথ্যা। ঠিক আছে, তাদের কাছে নেই, তারা কি করবে? কিন্তু আমাদের কাছে আছে। কথা বল, তুমি বলে স্যার তাহলে তো ব্রেস্ট ক্যান্সার ঠিক করে দেবেন আপনি? না, সে তো অগ্নিস্ফুলিঙ্গ নেই, শুধু দাউ দাউ করে আগুন জ্বলছে, তুমি কি করবে? তুমি জল ঢালতে ঢালতে পুড়ে ছাই হয়ে যাবে। এটা সম্ভব ছিল, দাউ দাউ করে জ্বলে ওঠেনি যখন। হ্যাঁ স্যার, বুঝবো কি করে? ইয়েস, বুঝবে তো বটেই। কারণ তুমি যদি বুঝবার চেষ্টা করো, তাহলে তোমাকে পেশেন্ট হেল্প করবে। হ্যাঁ ডাক্তারবাবু, আমার জানি না কি আছে ভাগ্যে, আমার কিন্তু মাঝে মধ্যে এখানটা কেমন করে। তো আপনি ভালো করে দেখেছেন? বললাম আমি গাইনোকোলজিস্টকে দেখিয়েছি, এক ম্যাডামকে, উনি খুব ভালো করে দেখেছেন। এটা বললেন না কিছু নেই। কিন্তু দেখুন, যত দিন যাচ্ছে আমার সেই যন্ত্রণাটা বাড়ছে, এবং আমি এখন কিন্তু প্যালপেট করতে পারি, কিছু একটু আছে। দেন তুমি কিন্তু এখনো কিন্তু সেই স্পার্কটা হিউজ ফায়ার হয়নি, তুমি ট্রাই করো, ঠিক হয়ে যাবে। কিন্তু যখন ব্রেস্টটা ফুলে গেছে, এত বড় হয়ে যন্ত্রণায় ছটফট করছে, লাল হয়ে গেছে, মনে হচ্ছে এক্ষুনি ফেটে যাবে, মানে আগুন দাউ দাউ করে জ্বলছে, তুমি জল ঢালবে তো? জল আনতে আনতে বা জল ঢাললেও সে আগুন তুমি নিভাতে পারবে না। ফলে বোকার মতো প্রশ্ন করো না, স্যার আমরা কি করবো এইবার? ও পুড়বে, তুমিও পুড়ে মরো, কারণ ওর সঙ্গে তুমি ওকে বুঝাতে পারোনি, তুমি নিজেও বুঝতে পারোনি। তোমার কি ডিউটি? তোমার ডিউটি হলো তাকে ছেড়ে দাও, তাকে বলে দাও আপনার মধ্যে আগুন জ্বলছে, আমি জল ঢেলে আগুন নেভাতে পারবো না, অতএব আপনি যেখানে গেলে ভালো থাকবেন সেখানে যান। ওরা বলেছে যা করতে, কেমো, রেডিও, সার্জারি, দয়া করে তাকে মিথ্যা আশ্বাস দিতে যেও না। নিজের দুর্বুদ্ধির জন্য নিজের দুর্দিনকে ডেকে এনো না প্লিজ। তোমার অনেকের আইডিয়া আছে, এই বোঝেই না স্পার্ক না হিউজ ফায়ার। যদি তুমি হিউজ ফায়ারকে না বোঝো, তাহলে তোমাকেও পুড়তে হবে পেশেন্টের। সেই জন্য কতটা আগুন জ্বললে তুমি তাকে নেভাতে পারবে, এই আইডিয়া তোমার থাকা দরকার, বা এক আধবার ওষুধ দিয়ে দেখতেও পারো। কিন্তু মূর্খের মতো কাউকে কথা দিও না, আমি আপনাকে সারিয়ে দেবো, আগুন জ্বলছে দাও দাও, তুমি কথা দিচ্ছ সারিয়ে দেবে, সেও পুড়ে মরবে, তুমিও পুড়ে মরবে। সেই আবার তোমাকে বলবে একদিন, এই ডাক্তারই আমাকে মেরে দিল, বলেছিল সারিয়ে দেবে। লোকটার কি দোষ? তুমি মূর্খ। তুমি স্পার্ক আর হিউজ ফায়ারের মধ্যে ডিফারেন্সিয়েট করতে জানো, তাই তোমাকে আমি মূর্খ বললাম। তাহলে তুমি কাউকে কথা দেবেন। এগুলো তুমি পড়ে দেখো, কিছু নেই, অন্তঃশ্বাস শূন্য। আমি দুই একটা জায়গা আমি ইয়ে করে রেখেছি। এই যে ওভারিয়ান ক্যান্সার, এটার জন্য দেখো না কি দারুণ, কাদের হয়? যারা নারী প্যারাস, তাদের কোনোদিন বাচ্চা হয়নি, বা যারা ইন্টারনাল জেনিটাল অর্গানের মধ্যে বিশেষ টেলক এজেন্ট ইউজ করে, আছে, এদেশে না হোক অন্য দেশে আছে, ওরা ওগুলো ইউজ করে পুরুষকে আকর্ষিত করতে, ইত্যাদি ইত্যাদি। আরো আছে ওবেসিটি, মোটা হয়ে যাচ্ছে। আর কি, হরমোন রিপ্লেসমেন্ট থেরাপি কেন করে তোমরা নিশ্চয়ই জানো। যখন তার মেনস্ট্রুয়েশন বন্ধ হয়ে গেছে, তখন নিজের চেহারাটাকে ধরে রাখতে, অন্যদের কাছে আকর্ষণীয় হতে, এই চারটি করে, হরমোন রিপ্লেসমেন্ট থেরাপি করে। এদের কিন্তু ওভারিয়ান ক্যান্সার হওয়ার জন্য এরা একদম রেডিমেড। আবার অন্যদিকে দেখো, প্রকৃতি এটাও করেছে। তাহলে এই যে নালিপ্যারা, এই যে টাল্ক এজেন্ট ইউজ করা, এই যে হরমোন রিপ্লেসমেন্ট থেরাপি, এই যে ওবেসিটি, এরা নিশ্চয়ই কোনো না কোনোভাবে এমন প্রোটিন তৈরি করে যার দ্বারা হার্মফুল গ্রুপ অফ জিন ইনঅ্যাক্টিভ থেকে অ্যাক্টিভ হয়, অ্যাক্টিভ থেকে ওভার অ্যাক্টিভ হয়। তাদের এটা আইডিয়া, আর এটা আমাদের আইডিয়া, দিস ভেরি প্রসিডিওর ক্রিয়েটিং ওভার অ্যাক্টিভ স্টেট ফর ovarian cancer. Next, see, very interesting. For a few days, I was ready for this class. See, protective factor include the use of oral contraceptive. তাদের ধারণা অনুযায়ী যারা ওরাল কন্ট্রাসেপটিভ নেন, বা যাদের অনেকগুলো বাচ্চা হয়েছে, বা যারা এদেরকে ব্রেস্ট ফিডিং করেছে, তাদের কিন্তু কি হয়েছে, সাপ্রেশন অফ ওভুলেশন হয়েছে। তাহলে এই যে তিনটে কথা, ওরাল ইউজ অফ ওরাল কন্ট্রাসেপটিভ, মাল্টিপ্যারিটি, ব্রেস্ট ফিডিং, এর মাধ্যমে এমন প্রোটিন তৈরি হয় যাতে করে ওভারিয়ান ক্যান্সারের জন্য দায়ী জিন ইনঅ্যাক্টিভ হয়, মানে টাইনি স্পার্ক এক্সটিংগুইশ হয়, দে নেভার বিকাম হিউজ ফায়ার, but above factors they become huge fire from tiny spark. See, other protective factor, such as fallopian tube ligation. বাচ্চা না হওয়ার জন্য যে fallopian tube লাইগেট করে সেটাও কিন্তু ওভুলেশনকে রুখে দেয়। মানে টাইনি স্পার্ককে এক্সটিংগুইশ করে দেয়। মানে that very protein which are responsible for making active and overactive that very inactive harmful group of gene, they will give them chance to become huge fire. Yeah, many things are here. If you please read it, then you will understand. Yeah, that thing you please see. Most of these women have a family history of uh, history of that that is notable for multiple cases of breast and ovarian cancer. Although inheritance, there is very interesting information. Although inheritance through male members of the family. See, the male members are the carrier and female members are the victim. So it is from there it happens. See, women with BRCA2 mutation also are at slightly increased risk of pancreatic cancer. See, the CA1 to 5, the cancer marker. The blood test you can profess regarding all these conditions. And see their procedure of treatment, the prophylactic removal of ovary and fallopian tube. এটা বাদ দিয়ে দাও, they will free from that cancer. Prophylactic oophorectomy also protect these women from subsequent breast cancer, with reduction of breast cancer, the reduction of breast cancer risk. এটাও হ্যারিসন থেকে নেওয়া। See, what I have told you many more times, early stage of tumors often produce protein that can be measured in the blood, such as CA1 to 5 and HE4. They are the marker. From this test, you can gauge regarding their future. See here, very nicely it is written. The individual can carry, the female individual can carry an asymptomatic and undetected tumor. Yes, they are there in the victim, but it has not producing symptom. And the physician will tell, yes, madam, no need to any treatment as nothing is there. But a genetic hyper. Always suspect every female or made female, everybody is carrying many more tiny spark. They are waiting to become huge fire. Nothing is there. You please read it. If it is any question, you can ask me in the class. Or today you can ask if there is any confusion. Here one thing is, they are very important. Estrogen, the hormone estrogen, they try to extinguish that tiny spark. But when it is associated with progesterone, unopposed, that is estrogen is unopposed by progesterone, are at high risk for endometrial cancer. Obese women treated with unopposed estrogen. That means estrogen do good for the individual if it is opposed by progesterone. If it is not opposed, then it will become dangerous. So this is up to today's class. Now you can ask for any confusion regarding the idea, gynecological problem and genetic homeopathic therapeutic system, and how you can control it, how you can extinguish that very tiny spark with which the individual was born. So if you ask, I will give you answer. Many more things are there. It will be given in the app and you read it and try to understand. If there is any confusion, you can ask. And you can ask also now. You may unmute yourself and ask. But what I have told you just now, that is a story of tiny spark. Really, I'm lucky now to explain today's class with the help of a tiny spark. And we everybody are having so many tiny sparks. And we are waiting for becoming huge fire. And we must die with that very fire. So the option is with you. You want to extinguish this tiny spark and must become free from any bad days, unexpected days. But again, I want to tell you how you will understand that you are free from huge fire. This can be done only with previous class, important prognosis of unsatisfactory evacuation. Tomorrow morning, Mona will give it in the app. Please read it very carefully. Now we are here for selection of potency, perfectly and scientifically, only with this very idea of evacuation. When I was not idea about unsatisfactory evacuation. That time, the higher potencies were used without proper judgment. Now, I think it is more scientific if you can take the help of this idea, the unsatisfactory evacuation, then the selection of potency of the medicine of different cycle will become perfect. So you can ask any day, any time, may it not be in this seminar, you can ask in the class also. And I am always ready to do all these things. So I want to end the class thinking this: you are having capability to extinguish any tiny spark by which huge fire will not be there in your lifetime. And you must be free from that very huge fire. You will, I must pray to the God for your healthy life, prosperous, peaceful, and healthy life with that very idea, with tiny spark, with extinguish, with the procedure of extinguish tiny spark. Today, our slogan must be there: we the real homeopath are able to extinguish any tiny spark with our idea, and that very idea is on importance and prognosis of unsatisfactory evacuation. So this to class is very in appropriate time, and you are having the idea all this thing. So my next class will be on prophylactic treatment with the help of genetic homeopathic therapeutic system. So when my time will come, you will, Prabir will tell me, and I will be here to tell you all this prophylactic treatment. So let me say good night. Thank you.